Kalush, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about herpes and pregnancy. The good news is that with information, most of the time the outcomes are great. So if you do have a history of herpes, then with proper precautions, the impact on the pregnancy can be very minimal. I've purposely not specified the details of the herpes because there's, in general, herpes type 1 and 2. Type 1 generally likes to be up here but can be down here. Type 2 generally likes to be down here but can be up here. You might know them as cold sores or genital herpes. But the viruses are very, very similar, act very similar, and have similar consequences to pregnancy and to babies. So if you have a history of either, so if you have cold sores, for example, you do not want to be kissing your baby when it's born. You don't want to expose it because primary initial infection for an infant or baby can be serious, very dangerous, and even life-threatening. If you have a history of herpes, then if you have outbreaks during pregnancy, we generally treat it. And the current guidelines are to start treating you with a preventative medicine, which might be Valtrex or acyclovir in the last month of 36 weeks, but definitely check with your provider because these recommendations change. The most important take-home message from this video is discuss it with your provider. If you're aware that you have either of these infections, let them know initially. Don't be embarrassed. You shouldn't be embarrassed. It's a very common infection. The majority of everyone, by the time they die, has one or the other